think we'll give everybody a couple more minutes to join. Okay. All right, I think we're going to go ahead and get started. All right, so welcome everybody to the first presentation of TCN EDU for 2025. I'm Karen and this is Maureen, and we are so excited to have you join us today. We placed a link in the attendance chat, or we will place a link in the attendance chat. Be sure to use that at the conclusion so that your attendance can be noted. Also, this will also be recorded. So now I will move on to Maureen to tell us a little bit about yourself.
Thank you, Karen. And can you all see my slides okay?
Mm-hmm.
Okay, great. Like Karen said, my name is Maureen. I am a psychiatric nurse practitioner. I work for Columbia Associates in the DMV. Specifically, I work in the Aldi office. It's a lot of information about me, but I originally went to Virginia Tech, worked in psych for a while up in Boston, actually right in the same territory that our Massachusetts market is in. And I went to Vanderbilt for my MSN, Northeastern for my BSN, and I'm doing my doctorate right now at Vanderbilt as well.
And I'm Karen, again, lots of information. I pretty much began my career inpatient in an inpatient facility, and then I moved to community-based clinics providing therapy in clients' homes and in schools. I also worked as a school counselor in the Arlington Public Schools. I joined Northeast Health Services in the mass market in 1998. During my time, I was a clinician. I also moved into assistant director and finally a director position in our legacy clinic of Taunton, followed by the De Novo Clinic in Milford. Currently, I am the National Director of Clinical Development and Training, and throughout all of my roles, I have maintained and still maintain a caseload and supervise these. All right.
All right, great. So just some training objectives that we're going to go over, and we're really hoping that you guys enjoy this presentation. I think it's going to be some really good information on how we can work together as prescribers and therapists to give our patients the best care possible. So the first training objective is to talk about how to collaborate with other providers. The second, why we work together to benefit clients. And the third would be an example of how and when we collaborate.
I want to begin by saying that not every person requires a therapist or a prescriber and a prescriber. Many have one or the other. Fortunately, at TCM, we offer both services as well as interventional services. So while each of these services are beneficial on their own, the greatest effect can be seen when they're in combination with each other. When a client's treatment suggests the need for more than one service, it becomes necessary to collaborate with the others to ensure the best possible outcomes for the client. This collaboration will also ensure that the client feels supported and bridges a potential gap between medication and therapy providers. Okay.
So we wanted to clarify the difference between therapists and prescribers. I certainly learned a lot just by reviewing this PowerPoint about the different kinds of therapists. You all have lots of different backgrounds that you can come from. So the list is there, but we have the Master's in Social Work, licensed mental health counselor, a PsyD, a licensed social worker, master's in education, master's in arts, and a master's in science, I believe, Karen, unless I got any of those wrong. And then for prescribers, we have NPs like myself. I'm specifically a psychiatric NP. And in the NP world, when you go to NP school, you pick a specialty right at the beginning. So your family med, your primary care, whatever you're going to do, psych, women's health, that kind of thing. So I'm specifically a psychiatric NP, which is the vast majority of the NPs that we employ through TCN. We have a couple FNPs here and there, family NPs. And then for physician assistants, they're sometimes called physician associates, PAs. A lot of our PAs have this special designation called a CAQ Psych. It means they took a special test, LPC2 from John in the chat. Yes, thank you. They took a special test to basically demonstrate their advanced level of psychiatric knowledge beyond what everyone else learned in PA school. And then, of course, you have physicians. So that's anyone that went to medical school, either an MD or a DO, and they completed a psychiatry residency. Oh, I think you're muted, Karen.
That would help, huh? As therapists, we have different educational backgrounds than do the prescribers. We may know a lot about potential of how medications might help relieve some of our clients' symptoms. However, it's out of our scope of practice to advise clients on how medication works and what should be prescribed for their symptoms. In the same light, prescribers have some training in therapeutic techniques for sure. However, in this model, their scope is medication related. They may provide some supportive therapy during their med visits, but the heavy lifting for both therapy and medication is left to the individual expert providers. Because of our diverse backgrounds, collaboration is the key to successful teamwork. The more we can learn from one another, the more effectively and efficiently we can treat our clients.
I also wanted to highlight that through collaboration, we're looking for improved patient trust, and that's through our shared goals. So when everyone is on the same page in terms of the patient's treatment plan, that can be very beneficial. For example, I have a colleague who's in the office next to me. We have a shared patient that we talk about a lot, and making sure that his goals in therapy and my goals with meds are in line, making sure we have all the information that we need from the family, all those kinds of things, because it happens to be an adolescent. Those things really wrap around the patient, and it helps us provide a much more holistic care. It's one of the benefits that we have therapy and meds in the same place. It's really nice to be able to walk down the hall and talk to someone. And we also want to make sure that our patients feel well cared for and well looked after. And if you have a therapist that has one line of thought and a prescriber that has another, and you're not really seeing eye to eye, you have different goals, you think the best thing for the patient is to focus on different things, that's going to leave the patient in a little bit of an awkward position. But the more that you can come together and line everything up, collaborate, the better we can take care of the patients and the more confident we can help the patients feel in our care of them. I think you're muted, sorry.
So collaboration does not always mean putting another appointment into your calendar. We all have incredibly busy schedules. We are most of the time booked back to back, whether you're a prescriber or a therapist. So communication can be done by using the tools we already have. You can use Microsoft Teams. You can use Valence Secure Messaging. Both of these are HIPAA compliant, so you can utilize clients' names. And in some cases, if collaboration does require more intense conversation between providers, then a separate meeting can be scheduled and should be scheduled. Most collaborations do not really take a long time. However, they do have a long-lasting effect on the treatment for our clients. And if they're done on multiple periods of time, then we're not missing any bits and pieces of information. So the shorter the collaboration and more frequent, the better we can serve our clients.
Mhm. When we think about coordinating a treatment plan, we're really hoping to decrease any treatment fragmentation. So that's what I touched on a little bit earlier of the patient feeling pulled in two different directions. If I think the patient's anxiety is the most important issue that we need to focus on right now, but the therapist thinks the ADHD is the most important issue. Well, from a med's perspective, that's, that would change my course, which meds I would go for first, depending on which of those I'm prioritizing. So to make sure that we are on the same page, so when the patient comes to see me, I say I want to focus on anxiety first. Then they go next door to therapy, and the therapist says, well, I think we should focus on your ADHD first. It leaves the patient in a really tough position, and it can cause them to feel as though they have to lean one way or the other towards one provider or the other, when in reality we're there to provide two different but similar services. We don't want the patient to feel as though they can only agree with their prescriber or only agree with their therapist, or it would be even worse if the patient decided, well, since they don't agree, I only want to see one of them. And then we won't even be helping them in all the ways that we would like to be. And it helps with treatment progress, and it helps everything move forward instead of taking one step forward and then a step back. And then the same on the therapy side. It's so much better and easier and more time efficient if you are able to take those steps together. And also for the clinicians on the line, if you think about the STAR-D study specifically, the quicker you get to the right antidepressant, the better the patient's outcomes are. That's one very specific example, but we know that the sooner we can help a patient get better, the better their outcomes are long term. So that's what we're really trying to focus on.
So the next, we wanted to make sure that we made this experiential as possible with examples, and we're not just sitting here lecturing at you. So I am going to read this slide. Please, read along, but I want to make sure that we're all on the same page. So our case one example is Maureen, a psychiatric nurse practitioner, is treating Sarah, a 34-year-old woman diagnosed with major depressive disorder. Despite being on medication, Sarah's symptoms such as low energy, hopelessness, trouble sleeping persist. Maureen recognizes that medication alone may not be enough and refers Sarah to Karen, a therapist with experience in addressing emotional and behavioral challenges. Through collaboration, Maureen and Karen communicate regularly about Sarah's progress. Karen helps Sarah address potential roots of negative thought patterns, relationship struggles, and patterns of behavior, while Maureen adjusts her medication to better support her mood regulation. This combined approach allows Sarah to gain coping strategies through therapy while ensuring the psychiatric aspects of her condition are effectively managed, leading to significant improvement in her overall well-being. So this is an example we see very commonly in our practice. Due to certain possible constraints of appointment times, caseloads, it's difficult to treat complex symptomology with only one modality. This can be seen in the opposite manner as well. At times, a clinician might notice that the sheer amount of energy a client spends on managing physical symptoms such as low energy, sleep inconsistencies, low mood, may be a barrier to their own ability to progress in therapy. Eliciting the help of a prescriber to evaluate the potential of medications to contribute to the management of symptoms can result in the client having additional energy to learn and implement new strategies to improve all-around functioning.
Another thing to consider is understanding the patient's history. So I've certainly encountered this as a prescriber. Patients often share more with their therapist. They share more content, but also more details of that content with therapists. That could be due partially to the relationship. I'm sure it's partially due to the relationship, but also the fact that therapists generally have a bit longer than the prescribers do with the patient. You have a little bit more chance to talk about what's actually going on in the patient's life versus I have to go over medication side effects, what's your pharmacy, that kind of thing. It's not as conducive to gathering a really complete history. We do what we can, but it's so helpful when the therapists are able to communicate those things to us. I really, really appreciate the therapists that I work with when they fill me in on things, even if it's an update to the patient's life. it's so helpful, especially because I don't always have that time, but to go into the appointment with the background of, oh, their sister is now very ill. Okay, that's going to be affecting their mood. That's really good for me to know. And the patient doesn't have to rehash everything that's going on, but I can say, yeah, I talked to your therapist. I heard what's going on with your family. Tell me a little bit about your mood and whatever it is we're talking about. So it's really helpful. And then again, the therapists, you are better than the prescribers at diving deeper into those topics and helping people to come to those independent conclusions and to help people really express what's going on deep down. You have much more training in that than we do, so you're better at it. And so I love to hear when you all are very successful in that, and then you can share what you've learned with us. I really appreciate that. It also saves a lot of time and distress and discomfort to the patient, especially when you're talking about someone revealing a trauma history for the first time or some sort of very, upsetting event occurs to the patient. It's very helpful if they only have to tell that to one person. One person puts it in their note. I can read the note. I can talk to the therapist. The patient doesn't need to rehash everything all over again. And that can be very, very beneficial for the patients.
So I think it's also important to note that collaboration is ongoing. Therapy appointments are usually much more frequent than med appointments, and therefore potentially the therapist will gather overall more information than the prescriber will. The client tends to limit the sharing of information at prescriber follow-up visits to medication effects and maybe some larger details, or if there's a major ongoing event affecting the functioning. Because of this difference, it's really important to collaborate on a consistent basis and share vital information. While clients are working toward exploring root causes of their identified issues in therapy, it remains important that they still are sleeping well, able to maintain a brighter mood, and have energy to continue progressing toward the treatment goals. So when we are all working together on a consistent basis, we can help the client. The client also feels comforted because they know that all of their treatment team is working together. They don't have to, like Maureen said, have to rehash and say the same thing to every provider on their team.
So we have another case example for you. This is part 1 on this slide and part 2 on the next slide. So James, a 28-year-old man who's been struggling with severe anxiety and occasional disorganized thinking. His symptoms have worsened over the past few months, affecting his ability to work and maintain relationships. His primary care provider refers him to Maureen, a psychiatric nurse practitioner, who starts him on medication to address the anxiety and potential underlying mood disorder. However, Maureen is concerned about James's disorganized thinking, which might suggest a more serious condition. Maureen reaches out to Karen, a therapist with experience working with patients who may have psychotic or mood-related disorders. Karen conducts a thorough evaluation of James' cognitive and emotional functioning, documenting signs of thought disturbance and emotional dysregulation. The two professionals collaborate, with Karen providing detailed insight into James's behaviors and emotional responses, while Maureen adjusts the medication to address the complex symptoms. Together, they identify that James's symptoms align with a possible early onset of bipolar disorder with psychotic features. With the combined efforts of both the prescriber and the therapist, James receives a comprehensive treatment plan that includes medication management and targeted therapeutic support, ultimately leading to more stability and improved functioning. I really like this example because it shows that we are sometimes able to catch serious illnesses earlier if we are working together. And as I touched on a little bit before, in psychiatry, as we know, the sooner we can get to someone and get to the bottom of the diagnosis, get them on the right meds, get them in the right kind of therapy, the sooner we can do that, the better their outcomes are. And this is a really nice example of bipolar disorder specifically. As we know, it's not always clear right at the beginning, especially those first couple of episodes. You're thinking maybe, maybe not. It's a serious diagnosis, let's do the meds in a specific way and all of those things. But the more that you can collaborate and also play to people's strengths, I think this is a great example of Karen has this really specific niche, this great background, and I can take advantage of that as her coworker and say, great, well, I know who I can refer you to. She's great. She knows her stuff, and she's going to help me figure this out. It's really helpful. So I really like that example. And it's a good reminder that we're not just doing this because collaboration's nice and it's good and all of that, but we can actually affect the patient outcomes if we're doing it frequently and regularly. Oh, Karen, I think you're on mute. Sorry. I told you you were on mute when I was on mute. So
Well, you know what? We will get this eventually. So the other reason why it's really, really important to have this ongoing collaboration, and to really get to know the client from all perspectives, the medication, as well as the therapy, is that unfortunately sometimes crises arise. But if collaboration has been ongoing throughout the client's treatment, then when the crisis should arise, it may be able to be managed much more effectively and efficiently. And the degree of the acuity of the crisis may also be less, having ongoing collaboration and possibly identifying symptoms and changes in this behavior much earlier on. Despite our best efforts, we cannot always prevent a client's crises, but we can work together to support the client and one another in the event. It is important to note that as a provider and as part of a team, you are never alone dealing with a crisis. Please reach out to collaborating team members, supervisors, your site leadership, when any of these situations occur. Crises can be really scary, and it's important to know that you're not alone to manage it. And this job's difficult enough when there aren't crises. So when there are crises, we also need to take care of ourselves, and we do that by coordinating, and debriefing and so forth with our own coworkers and leaders.
So in conclusion, we just want to highlight that we all have the same goal. We are stronger together if we work as a team than if we were to all work independently. And that as we utilize everyone's strengths, we can provide the best potential treatment outcomes for all of our patients, which is really what we're here to do. And then we've got our sources here. And then just to thank you, we also have plenty of time for questions. If anybody has questions, feel free to unmute, raise your hand, pop in the chat, whatever works for you.
And just to note also, I did put the forms for the attendance in the chat as well. Did we do that good a job? There's no questions.
Does anyone face any challenges with communicating? Oh, perfect. Michael?
So, thank you so much for that presentation. One of the questions I have is regarding I'm just trying to figure out how to phrase this. So, do nurse practitioners typically trained in typical development? And so let's just say you have a client who is neurodiverse or has developmental disabilities. So there's the collaboration between the therapist and the med provider or the practitioner, but then also the client. And so how might you talk with a client around appropriate medications, why you take medications? Does that make sense?
I think so. Are you asking how you can help encourage the client to take the medications that the prescriber has written for them?
Exactly.
Okay.
So
Yeah.
tangible possible tools and been like, hey, this worked for me.
Yeah. I think part of it is remembering that you're on the same team, right? As the other provider, and I mean ideally the patient. Ideally we're all on the same team, but you want them to get better. And I think patients appreciate more than you think saying, you know, that's not my area of expertise, but I've worked with Maureen for a while and I know that her patients get better. So I would trust her lead on that and remember that therapy is part of your treatment plan, but so is medication. Maureen wouldn't have put you on medication if she didn't think that you absolutely needed it. I would say things like that. And I would remind people too that it's important to continue taking your medication even when you feel better. That's part of why we take medication, right? We get to the point of feeling really good and then we want to keep it there. So I would remind people of that as well. Does that answer your question?
It does answer my question in a neurotypical sense. So I'm just curious how you might approach this when working with those with developmental disabilities, like practicality.
So collaborations don't just need to happen between the providers. So I've sat in with a medication appointment. Sometimes the client feels more comfortable with the therapist or feels like they have an ally in the therapist. So going in and attending, if it's okay with the provider, and attending one of their appointments and really supporting them through that appointment is also a way that we can collaborate. And again, we're trying to get the best outcomes for the client. So we will do whatever we need to within our time constraints, of course. But sitting in a telehealth, sitting in an inpatient appointment, we've done that as well and utilized that as a piece of collaboration.
Perfect. Thank you.
And somebody put in explain more about how Teams is HIPAA compliant. I don't know the technical part, but I will tell you that the Teams chat and the Teams, I'm not certain, in some markets, the video is HIPAA compliant. It's to use with clients, but in between our staff, so anybody at TCN, if you're using the video or the chats, that is HIPAA compliant. So our version of Teams is HIPAA compliant. Does anybody have a scenario that might be a question of whether or not collaborating would help, or if they've had difficulty collaborating, we can brainstorm some ideas. All right, well, if there are no more questions, then we will certainly not hold you here. We are going to be rerunning this presentation also on Thursday this week at 12. So if you have other questions, you certainly can put it in the chat. But if you have other questions and want to attend, again, certainly feel free to attend again at 12 on Thursday. Thank you so much for attending today.
Thank you.
Thank you all.